Oh, silence.
I know. Good morning, guys. How's everyone feeling day 2? Up and ready for it? Awesome.
And how was the gala? Good? Everybody looks so beautiful. All right, so we're here to talk about Aerolase, obviously. Has anyone in here got a treatment yesterday or the day before? Yes?
Amazing.
Enjoy? Good. So we know if you had a treatment that it's a really comfortable treatment, and it's no pain, no numbing, nothing, that you're dreading when you go to practice. But really, we're here to talk a little bit about acne and what a failure modern medicine has done for acne. If anybody goes to a dermatologist, we know what's going to happen. They're going to either put us on doxycycline, tell us to take Accutane, give us some cortisone cream, all these things that they think is the answer that we clearly know is not the answer if you've been down that road. So, and that's where Face Reality comes in, and Aerolase together is the perfect combo.
Yes, like game changer for me. So for me, obviously love Face Reality. It has been the biggest change for my business. And then I would say the thing that took me to that next level was incorporating the Aerolase, because I am in Texas, and even without having the heat, I started having clients that didn't want to have any downtime. And I felt like, okay, doing an enzyme is good, like we're getting somewhere, but it really wasn't moving the needle in the way I needed it to. And so with the Aerolase, being able to treat teenagers and they can go to school the next day and not worry about dryness or flakiness, and people that are going on vacation, like it just kept us consistent, because we all know the number one thing with any skin concern, especially acne, but also aging, pigment, whatever it is, it's consistency, and it's making sure that you're following that. So if you have a client that's like, has an event or has something going on every 2 weeks and they're falling off track, they're not going to get those results. So yes, 1000% you can get them clear 100% with Face Reality, but I love adding this in because it shortens that timeline. I get clearer faster, because what I like to think, it's like I'm working deep down with the Aerolase, right? I'm bypassing that epidermis. I'm going to the nitty gritty. Instead of like cleaning up the trash around the trash can, I'm destroying the entire can, right? I'm getting rid of it completely. And then with my peels, I'm working on top. So I'm like kneading like this. And like that is like the best method, is that I'm taking from here and I'm building from here. And so I'm getting that perfect balance, treating inside and out of the skin. So I do them together, I do them separately. It truly just has absolutely changed my practice. And especially any of you guys that struggle, or your clients are struggling with acne rosacea, papulopustular rosacea, the Aerolase has made it so phenomenal for me to treat, maintain, and control.
It's a definite game changer. And there's a lot of things about acne that I feel like we don't talk about that are major problems. The solution, go to Accutane, but what about the acne scarring? What about the PIE? What about all the other things that go along with acne that we don't address if you take medication? The other thing that is never spoken about with medication is not only is it dangerous, like health-wise, it can cause issues, but mental health. Nobody brings that up. But I know a lot of people who have taken Accutane and their mental health has suffered, and they were never warned about this. So all of a sudden, they feel crazy, but they don't know why. And it's related to that oral medication. And believe it or not, doxycycline can do similar. Okay, so it's not just Accutane that can cause that. Doxycycline can actually cause depression and other symptoms. And when someone is a teen especially, this is a big deal, because they're already in a place with their emotions. And then add that in, and then we're talking a really big deal. And pain for teens is something that they just don't want to tolerate. They would prefer to just have the acne. So with Aerolase, we take that out of the equation. I'm just going to talk a little bit about the technology and why Aerolase is truly different than something else that you would use for acne. Aerolase is the only solution as far as a medical device goes, and that the person isn't in this horrible pain, and it's attacking many things. It's working on the bacteria, it's working on the inflammation, and it's regulating the sebum production. So it's really it's doing everything we need to do to clear acne. Then when we add the home care of Face Reality, it's a game changer, because not only are they working on it when they're there with you, they're working on it at home too. So it never stops. Like we are continuously working on the acne issue. And it's important when you have a patient to not just do their treatment, we have to talk to them, educate them, tell them what you're doing, actually. You know, you don't want to just treat them and send them on their way. Like explain what you're doing, because the more educated your patient is, the better patient you're going to have.
Yeah, and I love it too because you can combine it with everything. So I do an acne pill on top. That's like my favorite way to treat acne. And it's great because those clients, again, like they're getting those results so much quicker. It's helping get the purging process done faster as well. So it truly has been so great because it's one of those things you can have someone price-wise do full face, or maybe they just want to do a spot treatment because they have like a big cyst that won't go away. So it's always running in my office 24/7. I'm able to just grab it and utilize it because there is no downtime, and I can treat every single skin type and color. And that for me is huge. I want to be very, very inclusive with my practice. I don't bring on devices that I can't use on every single person that walks in my door. So being able to safely treat skin of color was honestly why I got the Aerolase, because a lot of lasers, they're like, you can use this through fits 1 through 3, and I'm like, that alienates like 90% of my clientele. Because I do treat a lot of more melanin-rich skin. So I love that I'm able to treat everybody, and it's like anyone that comes in the door is a candidate for the Aerolase. So it's one of those additions to your practice and keeps those clients consistent, because they can't say, you know, no, I don't want to do it, I have an event. It's like, well, you're not going to have downtime, so you can, you know. It makes it easier getting those clients compliant and getting closer to those results faster. Yes. And then I love the Era too. That's an device that I got not too long after I told
and
myself.
You didn't think you were gonna?
No, I was like,
this isn't for me.
I know. I never thought I'd have a device. Anyone that's ever listened to my podcast, I was like very like I can get these results with chemical peels. But again, what changed the game for me was I was having clients that I was referring out for like blood vessels, little things, skin tags, and I'm like, you know, I wasn't whatever, right? I didn't care. But then when I started having clients that were kind of falling off the wagon, or they were wanting to do like, which we can't say brand names, but like a glow facial or something, you know what I mean? That like, it was like, yeah, it's good that we're getting a treatment, but like, is that gonna clear your acne? No, so I just felt like I ethically was doing a disservice to them, and I'm very results driven, I'm very ethical based, and so it just sucked, like, you know, being like, okay, like I just feel like I'm shooting in the dark right now.
Right, and putting a Band-Aid on.
Yeah, because I'm like, okay, like a water facial is not going to move the needle as much as doing an acne peel or doing an Aerolase. And so with that, I was like, okay, I'm getting them results. They're happy because they don't have downtime. And honestly, it's getting them to that goal quicker. And then the Era I brought on, so this is the ablative laser, which I absolutely love for acne scarring. I love it for pigment issues, PIH, PIE. I mean, it has really changed the game. But I'll be honest, if you had to go with one to start out, always the Neo, because you will be able to treat so many concerns. Like you can treat anyone who's dealing, I mean, literally anything. Like I've had people with ulcers you can treat any kind of irritation on the skin. I've done like, literally when I got attacked by monkeys, I didn't get scarred too bad thanks to the Neo. I mean, it's like crazy. It's just like everything. Neo, bruising too, if you do everything. Injectables. I mean, it's just like always my number one go-to.
Especially like I hear a lot of people who have a one-man show. You know, you have a spa room or whatever, and you know, you were a one-man show, you know, in the beginning. And to have the Neo, you literally have an entire med spa like in this little box, and you can do everything. Yep. You know, you're not limited. Most devices do one thing, right? So you spend a lot of money and you can only do one thing. So how much ROI can you really bring in with one thing? You know, if you're doing rejuvenation or you're working on browns and reds, it's very limited. Also, it's very limited from say March to September, because you can't use it, because if anyone has any sun, they're X'd out. Also, the other thing is, like Savannah was saying, skin types 4 through 6. You know, I don't ever see skin type 1. I don't even know if they exist. I mean, I just don't. So we're talking 2s, 3s, maybe we will see, but a lot of patients are 4 through 6. And if you can't treat them, it's really like you're cutting out
a
half of your
huge
practice.
clientele.
you know? And I just think, I used to teach laser biophysics, and I would teach them the didactic, but when it came time for them to get a treatment, they couldn't. So like, who wants to take a course when you can't even feel what a laser feels like?
Yep.
You know, where Aerolase, nobody is left out. You know, it's all inclusive. And it's the only new technology that exists in the market. People reinvent things a lot, you know, and they name it a fancy name, but that's just like a nickname. It's not really what the device is. The device is the modality. You know, what is the device? So 20 years ago, it might have been called fluffer-nutter, whatever. And then today it's called something else, but it's really the same thing. They just reinvented the wheel and made everyone think it's this great new thing when it's really not. It's still the same modality it was 20 years ago, but now it has a touch screen, or, you know, it has some fancy something that makes you think it's different. And unfortunately, people don't know. They just don't know, and that's okay if you don't know, but if I could give any advice, it's educate yourself so that you're not depending on the rep that comes into your practice for everything. You already know yourself, so they can't trick you. You know, they can't say, oh, my laser does this. Well, if you did your research, you can say, no, it doesn't, because it can't, you know, so that's really important, I think.
I agree.
And you talked a little about Era. You know, when we're done with acne, we are left with scarring, you know, and PIE, I feel like PIE and hypopigmentation are my two least favorite things, because they're really hard to deal with.
But I will say too, I think incorporating the Neo during that clearing process is helping stimulate and build that collagen on the back end. So I'm actually seeing those clients have less severe scarring. And if they really do have some box scar, ice pick, then that's when I'm really interested in bringing the Era into play. But it's crazy seeing the clients that are using Aerolase before they're clear, like in addition to that clearing process, their scars are way less severe.
Yeah,
and their redness goes away too. Because that's the thing that I feel like I see a lot is like people, you get them clear and they're like, my skin looks worse. And it's because like behind all that acne and it was redness, right? So now they have redness behind, and so they're disappointed. And when I'm doing the Neo, I'm able to minimize that redness so much faster. So it's like a really night and day dramatic difference when I'm doing those before and after photos.
Yes, for sure. Era is kind of like the polish.
Yes.
You know, when you're done clearing the acne, you bring that Era in, and it really cleans everything up, and you know, smooths the skin. And the PIE works with the Neo, but it takes time. You know, it doesn't happen. You treat, the next day the PIE is gone. It takes time. It has to go through the process. You know, we always talk about lasers, and like people get a treatment and they want to be totally changed from that one treatment, but at the end of the day, laser energy is kind of like medication. It's just laser energy. You know, so when you take a pill for some type of illness, it has to absorb and it has to get into your bloodstream and then go to work. Well, laser energy is similar. It's a medication. It has to be absorbed by a chromophore and then go to work. And it doesn't happen in 1 second. It takes time. So that's why sticking to a protocol and doing the proper protocol and being patient is a huge part of the whole treatment. And communicating that to your patient is huge, because if they know that, then they know when they're home, oh yeah, Savannah told me this, or you know, Katie told me this. I know this is going to happen like this. Not sitting there guessing like, well, what's going on? I still have this or I still have that. They know what's happening along the way.
Definitely.
So why are we different? I mean, we're so different.
I think the coolest thing for me is that I learned is that the crystal is housed in the handpiece. So especially for treating skin of color or pigmentation disorders, it is so important because it's getting that less energy, right? It's getting its job done with less energy, so you're not getting too much heat in the skin. It has a very short pulse duration in and out of the skin before that burning threshold, which is key because we don't want to negatively impact the melanocytes to make them produce more pigment. We want to get in and out, suppress, and leave. So that for me was really cool because again, you know, anyone's going to try to sell you anything. And when I learned like the difference that a lot of devices, their crystal, which is that powerhouse, it's in their actual device, has to go through that tube into the handpiece and then to the skin versus going straight from that handpiece into the skin. It makes a big difference. And and pain tolerance, results, and of course, not causing any damage to the skin.
Yep. And it kills the C. acnes, so that reduces the inflammation. Even after one treatment of acne, if someone is really flared up and their acne is just really like red and irritated, one treatment, it's going to look better because it calms it down. So they're not so inflamed, everything just looks calmer. Now, it's not gonna just make the acne disappear, but they're gonna feel better already because things aren't as, so in their face. It's calmer, it looks better. Usually after, I would say 2 to 3 treatments, I'm really seeing change, especially if I add in a face reality home care, and then maybe like a peel or something to help to calm it down too. Because once an acne lesion comes out, you can't make it go back in. It has to go through its process to clear.
Yes.
So it's not gonna go away, but it can calm down and clear faster, which, to anyone, that's great news.
And I also want to mention, because I always get asked this, like, what's the difference between like an Aerolase and like a BBL or an IPL? And with that one, it's completely different technology, but you're literally just like taking off the surface, and then it's going to come back up, because we know the skin, when we have skin issues, it's deep. It's not just on the surface of the skin, like it's almost like a root, so it's deeper down. So yes, like you're going to see a difference, but then I always get those clients like, I got the like 5 series of this, and like my pigment's still bad, or my redness is still there, and it's because it's not actually targeting the key issue. It's just getting the aftermath, right? Which is good in some cases, but I mean, if they really want that long-term result, that's what Aerolase is going to be, and it is one of those that it takes time to build because we are working so deep in the skin for that dysfunction. And another thing that I love, I don't know how many guys have probably heard me talk about this, but it's hard when clients, especially when they're dealing with acne, want to get like big peels done or big lasers done because they have to be off their home care. And it makes things 10 times worse. And it took me like probably 2 years to kind of put 2 and 2 together in my practice and be like, okay, like this is regressing it, like going more aggressive and having them, do an ablative laser, having them do like a really deep chemical peel, and they're not using their BPO, their Mandelic, those products that have kept them clear and are continuing to keep acne at bay. I'm just backtracking all of the progress I made. They get pissed. They think I did something wrong. And so I like to have my clients completely clear for about 6 months before I would do an era, even though you can go super light with it and not have like crazy downtime. But the reason the Neo is so great is they can go that night and put on their 5% acne med and wake up the next morning and use their 8% Mandelic. Like there's no way that they need to be off any products before the treatment, after the treatment, etc. So that is extremely key to keeping acne clear. Acne craves consistency, not skin cycling. You want those lower percentages daily instead of something super strong a couple times a week. So that's always been my philosophy with skin, and one of the reasons Aerolase works so amazing with my acne clients is because they can do what they need to do and not veer off my regimen or off track.
Yes, you don't have to. That's what's so amazing about Aerolase. Like, you don't have to change your lifestyle at all.
You can go work out after, literally.
You can go work out, you don't have to change anything. Most lasers, you have to prep to come in for treatment, and it's a big production.
Yes.
You can't treat, I can't tell you how many times before I was introduced to Aerolase, I would come into the clinic so early, making sure my laser works, moving it, because God forbid you move it and it has to recalibrate. It's just so many things. It's like a whole production.
I have to say this. I have a lot of devices in my practice. My Aerolase is the most used and abused girly pop out of the crew, and she has never had an issue. Devices that I maybe use twice a month break the one time they get used. So that's something too. The reliability of Aerolase is so huge for me, because that's money out of my pocket. And I'm sure you guys know there's like devices that we get, and then like it's just embarrassing, 1, and 2, it's like, it's just time is money, right? It sucks to have to turn away a client because your device isn't working. I've never, not once, and I don't know how long I've even had it. Time is so crazy. 3 years? 3 years, same device. I've never once been like, oh, it didn't turn on, or oh, it's not pulsing right, or oh, something weird or wonky is happening. So that to me speaks volumes, because I can tell you I have 3 devices in my office right now that I'm about to like throw on the interstate. Because it just is frustrating. And then the support too. That's a really big thing for me, is just people care. And I know I'm a big account, but I hear it from people that have bought the Aerolase from me, and I sometimes hear this when people buy a device because of me, and they're like, hey, like, is your rep suck too? And I'm like, it's embarrassing. And I'm like, I feel bad because like they're getting this device because they see, you know, what I've done with it. Aerolase is completely different. Everyone has nothing but amazing things to say about the support, the training, like, and the time and effort and energy and the resources that they put out, because it is intimidating, you know, the first time. I mean, you remember me, my first time, she was like, why are you so scared? I was scared to death. I was shaking like a chihuahua, and I was like, I have to be perfect. Like, I'm scared because it had been so many years since I'd touched a laser, because I couldn't afford one. So yeah, I mean,
You picked it up
like it's so easy. I was like, why am I stressed? Like, microneedling is harder than that.
Absolutely.
Yeah. Doing a chemical peel, doing a faciality chemical peel is harder than operating an Aerolase, I would have to say.
Yeah, I mean, and lasers are, you know, understanding lasers is very important. Like, you need to understand, what do lasers do? How do they work? Why do they work? That's important. But as far as functioning the device, I mean, a 2-year-old could function the device, but skin is the key. Knowing what skin and how skin works, you know?
Yep.
And 20 years ago, it was like, go hard or go home. That was like a big thing. Now, I personally think the skin wants to be treated properly. It doesn't want to be abused. You know, if I was abused, I would push back against it, right? The same with the skin. If you abuse it, it shuts down. It doesn't want to heal.
It's literally like the one night stand versus like whining, dining, slow burn. You know?
There you go.
That's what you want to do. You want to romance
20-something, 50-something.
Yeah, exactly. I'm like, you know me, I like my analogies. That's how I think. It's like, literally, people are like, one night stands, how you treat the skin, like, go hard and fast as possible. And now it's like, no, like, I'm going to get to know you first. Like, what's your pet's name?
Absolutely.
You know, what's your favorite color?
Nobody wants downtime anymore. You know, before people would say, I'm going to take a week off from work, get my laser treatment. No,
I think
wants to do
especially
that.
since COVID, because people were so like locked down that now everyone's like out and about again, and like they want to go to concerts, they want to go meet up with their friends, and like even people that aren't like influencers, like everyone's on social media. My mom makes TikToks. I'm like, why are you making TikToks of the dog? She's like, it's so fun. I love it.
It's fun.
And so people are out there, yeah, and it's one of those things, people want to get stuff done without it looking like they got it done. And also be able to resume their normal lifestyle, especially post-COVID, everyone's out and about. So, I mean, it's just fit beautifully in my practice. I was a little nervous about pricing. I'm like, are people, my clients, like, are they gonna be able to swing this? And I was shocked, honestly. I did not expect the reaction to be as good as it was. And I think people with laser already have this like pre-notion and expectation that like it's not going to be cheap, and so that's what's amazing. And I mean, I paid off my device and knows my numbers. How fast was it? I never tracked that. I'm like, I don't care about finances. That's why I do skin. What? 4 months. So it was like, and it wasn't as popular when I brought it on now. And I think that's the cool thing, is that people are searching out the Aerolase in your area. And I'm sure some of you that are estheticians have probably heard, you know, your clients like, what's the Aerolase? Like, have you heard about this? Like, should I get this done? And I think that just speaks volumes too, like when it has a name like that and people know about it, it makes it a lot easier to sell. So I would not imagine it being as difficult as it wasn't for me, but you know, it's just, I don't know, it's just when I think of my business, like Aerolase is such a huge core part of it. Like, yeah, I mean, it's the bread and butter of everything I do. I do it with everything. I do it with my peels, I do it with microneedling, I do it with water facials, I do it with all kinds of different things. So it really just plays beautifully, and it's like an addition. And again, anytime I'm doing it, I know I'm getting better results, quicker results, and doing best by my client.
And the aspect of the combination, you know, some people say, oh, it has to be combined. No, it doesn't have to be combined. But if you can combine, why not? Because otherwise you're doing a laser, then you're bringing someone back in 2 weeks. You can do it right there. You do your neo, pretend you didn't even do it, and do whatever you want after. That is unheard of with lasers. That does not happen. So if you can do your laser with a peel, your laser with a water facial, your laser with whatever, that's two treatments in one. It doesn't take a lot of time, and your ROI is changing. You know, part of being in medical aesthetics is you do have to be a salesperson to a degree. But if you're selling something that you know morally is going to help your patient, it feels good. That's why they came to you, to get improvement. When you're selling them something that's not going to work, that doesn't feel good, right? You know, we want to be out there helping people, not, you know, hurting them or giving them treatments they don't need. I can't tell you how many times someone says to me, because they know what I do for a living, I had a laser treatment. Oh, really? What did you have done? I don't know. How do you not know? How do you not know? That is so crazy to me. So, you know, it's so important for your client to understand and know what's being done, that it's safe. We see so many tragedies out there on TikTok, Instagram. That does not have to ever happen. You know, I've been in this business for 20 years. I have never damaged someone's skin. And it's because I know what I'm doing. And I make sure I'm careful. And I start slow because every patient is different. It doesn't matter if they're both skin type threes, they're different. I have twins, totally different. So you have to look at everyone different and treat them properly.
Yep.
You know? So now we're talking about Era. Listen, Era is, I was introduced to Aerolase 12 years ago. And I worked with a doctor who did CO2 for a long time. And I loved it, but I couldn't do it because I'm not a doctor. So when I saw Era, I was like, oh my God, this is amazing. So Neo and Era together, you're doing every possible thing that you can do for the skin.
Love.
Internal, external.
Yeah.
So it's like, a lot of times it's the first treatment I do because I just clean everything up.
Yep.
And then I go from there.
Love. Yeah, the reverse protocol is one of my favorites. So that's using the Neo first and then Era on top same day. It's wonderful.
And the Neo's down there, it's building collagen, it's working on browns and reds, it's working on acne, hair removal. And then you're going in and you're taking those layers off the top, new skin is coming, and it's just beautiful.
It's amazing. I love it.
It really is. And it doesn't hurt, no numbing.
Yeah,
I mean,
it's not bad. And I'm a
that's
baby.
crazy.
I'm a baby, and it's not bad.
Yeah.
And I do like the hands. I mean, I've done so much with
everything, the stomach,
Kneecaps.
top of your knees. And it just changes that texture of the
It's
skin,
so
the
good.
tone of the skin, the pore size, it's all eliminated.
Oh, yeah.
So.
We love. Tyler had a little cookie brown face after Italy.
Oh, Tiger loves Era.
Yeah, like he literally looked like a chocolate chip cookie right after we went to Italy, and we did like the lowest level on him because he had like a musical concert or something that weekend, and literally one treatment, just the Era.
It's phenomenal.
He was like porcelain little doll again. It was after 5 days.
Yeah, and I mean, you heal very quickly. The healing is very predictable.
Yeah.
So like day 3, you're like, I'm not going to be healed by day 4 or 5, and then you are. It just, every time it's the same. You think, oh, this is going to take longer, but it doesn't. It's always predictable. The older you are, it does take a little longer than if you're in your 20s, your skin's already turning over quickly, so you heal a little faster. If you're in your 50s, it takes a little longer because your skin's going slower, but not that much longer. The other thing with Era is you can do spots because there's no demarcation.
Yep.
So you can just do an eye treatment, you know, do around someone's lips, do a décolleté, you know, and then you top of the knees, wherever you want. You don't have to do the whole face if they don't want to. Now, personally, if I'm going in, just give it to me.
Yeah.
I'll just do it. But some people do, and you can go all the way to the lash. So there's not many treatments you can go inside that periorbital rim, but with Era you can because of the modality, and it's not dangerous to the retina. So it's safe, and you can get some really great results, and maybe save yourself from a blepharoplasty. Give yourself a couple extra years, you know? So I just love Era. And Era can do ablation on skin of color, which is the only device that can do ablation on 4 through 6.
Yep.
And we have done thousands, and we don't have issues.
Yep.
You know, if you do it properly, how we do it is because we have that 300 microsecond pulse, so that removes some trauma. And then we lower the energy, removing trauma, and we cool the skin, removes trauma. When we remove those 3 things, then it allows us to treat darker skin types. It just makes sense. Now, we can't do a deep treatment on skin of color. We have to do multiple.
Not aggressive.
But they have less downtime.
Yeah.
You know, so there's benefits to both.
Yep.
For sure. And these are some pictures. They're, you know, really good pictures. And these are all Era pictures. I like the lip lines. A lot of people complain about that. That's a big thing. Lips, under eye, I hear all the time. And Era is wonderful for both of them. Scarring. Oh,
Good for scarring. Not good. Great.
The Neo is amazing. I had a hernia and they told me I was getting microscopic. I came out of the operating room, I had like a 7-inch scar on my stomach. I was so annoyed. I never had a C-section, 4 kids, and now I have this 7-inch scar. So I started treating it immediately as soon as my sutures came out. You couldn't find it if you looked for it. That's how great it looks.
That's amazing.
And the newer that the scar is, the faster, the better result you get. So if someone comes to you with stretch marks from like 20 years ago, it's going to take a little longer. But if something's new, it's very easy to
Get it while it's
fix.
fresh.
Get it while it's fresh, for sure. Yes. And the younger someone is, again, I can say this because I'm old, but like they do get faster results and not so much better results, but it happens faster because they already have collagen that's happening. When you're older, you have to wake that collagen up, then it has to come to the area, then it has to start building and doing its work. So it takes some time, but we get there, we get there. Here's some more. You can see how amazing we do for the pitted scarring, which is also another thing. Skin of color, PFB, very common. You hear about it all the time. It works wonderful. More photos down in the left, my left, so it would be your left too, left corner. She's one of my trainers. I don't know if anyone has Aerolase, whatever. And I did that treatment a while ago, and she was so reluctant to do ablation. She was like, oh, I don't know, it's like a lot. Well, I mean, look at her results. And she didn't even have bad skin. And her skin looks amazing. It just smooths everything out. It brightens, it just really does phenomenal. So obviously we're not just active acne. We talked about this. We work on PIE and scarring and all of that, which, you can do a course of Accutane, but at the end, you're still left with all of that. So you have to come and do something else anyway. So why not just do it the whole time? And then when you combine your home care with Face Reality and the peels and the products, it makes things happen so much faster. Okay, I think I already talked about that. I kind of get ahead.
I know, you're like me. I don't follow PowerPoints.
Yes, exactly. So we are really the only new technology in this industry. That's a fact. Everything else has been around. We are new. We have a short pulse. We're air cooled. No one else is air cooled. That's why we're little. A lot of times people think we're little because we're not, good enough, or it's not the same. That is not true. We're little because we are cooled by air. Okay, so it's just that little box. You can take it on a plane. You can take it room to room. So it's really good.
Yeah, it's great. And especially if you're in a salon suite, you don't have a lot of space for a big, chunky device. Yeah. It's great. You can literally store it underneath your bed. That's great.
And your whole room heats up. If you're in a salon suite and you get a big laser, you're like,
you're gonna die.
The room is hot and it's just craziness.
It is.
And then here we go with financial impact. So I am clinical, so I'm not really good with finances, but I will tell you this. When I purchased Neo and Era, this is 12 years ago, we paid the Neo off in 6 months and Era in 8 months.
Wow. It's amazing.
It's pretty good. Yes. My medical director was like, you better. But honestly, it wasn't even difficult.
No, and I think what I want to say, one of my favorite things about Aerolase as a company is that they don't nickel and dime you. When you get a device and they're like, well, you got to pay per pulse. You had just paid $300,000, which is not how much the Aerolases don't weigh. But you just paid $300,000 for a device, and then you have to have a card that you have to keep buying to actually use the device that you just paid. Or the cost of a house for.
It costs $75 for the
tip.
It
makes me so mad. I hate that. And so that's something that I love is once you really pay off your your consumables, all you need is the filter, and I think it's $1 for the filter. So your cost once it's paid off is literally it's just your time that people are paying for. So you're just making money. You're not having to put a card into a machine and buy more points or have to type a code into your system and go online. I hate that. So that's one of my favorite things about you guys. It's unheard of that companies do, it's just everything's about the money and how much money they can get out of us. And as a solo esthetician and how I started, I couldn't afford a device alone and then also every month be having to pay to actually be able to use the device I already bought.
And you can add this all the time. Like you think to yourself, I'm never going to do toenail fungus. But how about this? Your patient comes in, she's getting a facial treatment, she has on flip-flops, and she's like, I'm so embarrassed, I have this toenail fungus. Great, come in next time and we'll treat that. Or she's talking about her son who has eczema. Great, have him come in, we'll treat that. So you'd be surprised that the treatments you think you won't do, you end up doing because you're talking with your client and it comes up. So that's another, factor. The amount of money, the ROI, there is no one, not one patient that comes in the front door that cannot get an Aerolase treatment. Not one patient.
Everyone's a candidate. Like you literally go outside and chunk a rock and every single person you hit with it is able to get this treatment. So, I mean, it really is. It's not like, oh, like you don't have the right skin concern or you don't have the right skin tone or, no, you're the wrong age. Every single person can benefit from this. Honestly, I always get obviously parent consent, but I've treated as young as 8 because their moms don't want them to do chemical peels. This is like healthy energy for the skin. So it's really great to treat those younger patients.
Yes. I treated, my girlfriend's son is 2 and we told him it was a video game. And he was all about it.
That's so funny.
Yeah, and it worked, and his eczema was cleared, and he wasn't scratching his hands off. I mean, the kid was like bleeding from scratching, and it was gone. The other thing is, I always used to make my patients finish a protocol. If they did that, what I had them do, then I put them in a club, like the Neo Club. So if they came in for microneedle, if they came in for chem peel, they could add a Neo to that for a cheaper price because they did a protocol. So now they're using it all the time. So even though they're coming for other things, they're still adding the Neo into it. It's helping you because it's working on their results, it's maintenance, and they're getting a better value.
Yep, and you can do it every 2 weeks is the other cool thing too. You're not waiting an entire month, so you can see your clients twice a month. That's double the income. So it's great that you're able to get those results so quick. And like for me, I'm like, let's get this as fast as possible. I want to get you clear, and then I start doing maintenance. So I'll have them come in then like every 4 to 6 weeks after we're done with that 2-week process. And that's honestly crazy because it lines up perfectly with what, guys? Faciality's protocol every 2 weeks for those chemical peels and professional treatments. So it just slides right in perfectly with what you're already doing in your practice.
And other lasers claim that they can do rejuvenation that are in the same modality. Well, that is not true because for rejuvenation to happen, the dermis has to get hot enough that it thinks there's an injury, okay? So the only way to do that is doing multiple passes to get that dermis hot. You can't do multiple passes with a traditional ND-YAG. The patient will never come back.
Yeah. Oh no.
So that's just another. We just win the acne game, hands down. There's no question. There is absolutely like no broken promises. It's just the truth.
Yeah, I've never had anyone be like, darn, I regret doing the Aerolase. Like
never, absolutely never. My daughter works in a clinic where it's like a clinic where they have like 100 devices. They have Neo, and when my daughter came, she uses it all day long. Yeah. And she loves it. Now all the other estheticians are like, I want to do that.
Literally the fact that it's literally Lauren and I in the new space that are treating people, and I had to buy another device because I'm like, there's no way, because both of us, like we can't, that's why right now she can't work at the same time as me because we both are like going to fight each other for the Aerolase. So I'm putting one in her room, one in my room, and that machine is on. Like you will hear it all day long. Like there's really not a treatment I don't do without it.
And if you have an injector, that's another person who can get involved because it works on bruising and swelling.
And it's so safe too. If you have like a bunch of people underneath you and you're terrified about like the liability of it, they can really not hurt anyone. Like it's one of the safest and easiest devices to use. And so for me, like as I expand, like that's something that's, it makes you nervous, being like, I know myself, I trust myself, but having people underneath me using devices, like it can be super scary because that's your name, and with the Aerolase, like I would literally feel so comfortable with anyone who worked for me using it.
Yes, it is very safe.
Like I would let Tyler do it. I have.
But when we get into smaller spot sizes, there's a little bit, you know, of risk if you're not using it properly, but that's something you'll be trained if you ever purchase the device and talk about those things. Here we go with some before and afters.
Yes.
This is after 2 treatments. You know, she looks so much better. This is amazing. Wound healing is another thing that, you know, we do. And acne, if you really think about, it's a wound.
Yeah.
You know, especially if you're me and you pick it, it's really a wound. Even though I tell everyone, never, ever pick. My husband like throws my mirror out, my magnifier. Here's some really good, this is to Era, to Neo. This is a beautiful, you know, even cystic acne that's so hard to deal with, it works so good. It calms down that swelling and that really, you know, pain from the cystic acne and gets to that.
Yeah, this was, all those were our amazing SBA clients.
Yep. That's one treatment. That's unbelievable.
I think Lauren did that one.
Yeah.
Hey,
So
Lauren.
that's our presentation. But honestly, if you're going to get a device or if you're in the market for a device, I know I work for Aerolase and everything, but you know.
Well, yeah, and that's
you
what I
have
want
an
to say
Aerolase.
too. I want it real quick is I have device companies every day, like we will pay you and give you a free device just to talk about it. I'm never that person. I paid full price for my Aerolase and trust me, I did try to get a discount and I didn't, and that's okay. But I say that saying I don't work with companies that I don't love. I'm like a cat. Like I have to come to you and then I'll work with you, but I'm never like one of those people. And same thing with Face Reality. Like I started with them, I chose Aerolase. Like every company I work with, it's a choice for me. It's not because I'm getting paid to say something. So I wholeheartedly back it. My reputation means everything to me. Being a leader in the industry and helping people know what to trust and do, I don't take that lightly. So I wholeheartedly can tell you like it is the best decision I've made other than being an acne expert. It just changed my practice. It really did. So obviously don't put yourself in a financial bind. But when you get ready and you feel like you're at that place with your business and you're starting to look and want to invest in a device, that's the way I would go.
And I wouldn't work at Aerolase if I didn't have this passion for it. You know, I have been offered to work in other laser company. I work here because I believe so much in this device and I want it to go as far as it can go because I know how many people it can truly, truly help.
Yep, and that's what it's all about at the end of the day is changing lives, making a difference. And that's what Aerolase and Face Reality do.
Yep.
Thank you.
Thank you so much.